If you're over 60, there's one thing you probably do every single morning without thinking twice about it. You've done it for decades. Your parents did it. Your doctor has never once told you to stop. And yet, right now, researchers at some of the most respected medical institutions in the world are quietly calling it one of the most underestimated stroke triggers in older adults. It's not smoking. It's not drinking. It's not skipping your medication. It's something far more ordinary than that. Something that happens in your kitchen, or your bathroom, or right there in your favorite chair. And the reason it's so dangerous is precisely because it feels completely harmless. Because it always has been, until your body hits a certain age and the rules quietly change. Every 40 seconds, someone in the United States has a stroke. And nearly 3/4 of all strokes happen in people over the age of 65. But here's what the statistics don't tell you. A significant number of those strokes didn't come out of nowhere. They were building quietly for weeks or even months, triggered and re-triggered by a daily habit the person never thought to question. I'm going to show you exactly what that habit is, why it becomes dangerous as you age, what's happening inside your blood vessels when you do it, and what you can start doing today to dramatically lower your risk, without a single prescription. Hi, I'm Dr. Chester, and I want to be honest with you about something before we go any further. In nearly 2 decades of medicine, the conversations I dread most aren't the complicated ones. They're the ones where a family is sitting across from me in the ICU and they say, "He seemed completely fine yesterday. He was just doing his normal routine." That phrase, his normal routine, is the one that haunts me. Because more often than not, that normal routine was the problem. So let's talk about what's actually going on inside your body, and why, after 60, certain everyday habits stop being neutral and start becoming dangerous. Why your brain becomes vulnerable after 60. To understand stroke risk, you need to understand what's happening inside your blood vessels as you age. Because most people have no idea, and most doctors don't take the time to explain it plainly. Your brain is the most blood-hungry organ in your body. It accounts for only 2% of your body weight, but consumes 20% of your total oxygen supply. It needs constant, uninterrupted blood flow to function. Not occasional blood flow, not mostly consistent blood flow, constant, every second of every day. Now, when you're young, your blood vessels are like brand new garden hoses, flexible, smooth on the inside, able to expand and contract easily in response to pressure changes. But as you age, something happens to those hoses. The walls get stiffer. A process called arteriosclerosis begins laying down calcium and fibrous tissue in the vessel walls. The inner lining, called the endothelium, gets thinner and more fragile. Small fatty deposits called plaques begin accumulating, narrowing the channel through which blood flows. By the time most people are in their 60s and 70s, their cerebral arteries, the vessels feeding the brain, look nothing like they did at 30. They're narrower, they're stiffer, they're far less forgiving of sudden pressure changes or disruptions in blood flow. And here's the critical part that most people miss. This process happens silently. There's no pain. There's no warning alarm. Your blood vessels can be 60 or 70% narrowed before you ever feel a single symptom. This means that by the time you're a senior, your brain is operating with a much thinner margin of safety. Small things that your body could easily handle at 40, a sudden spike in blood pressure, a brief drop in hydration, a sharp increase in blood viscosity, can now tip you across the threshold into a stroke event. And that brings us directly to the everyday habit we need to talk about. The habit, morning dehydration. The habit is this: waking up and not drinking water for the first 1 to 2 hours of your day. Now, before you click away thinking this sounds too simple, stay with me. Because the physiology of what dehydration does to a senior's brain is anything but simple. And I promise you that by the time I'm done explaining the mechanism, you will never look at your morning routine the same way again. Here's what happens inside your body every single night while you sleep. You breathe. Each breath releases moisture into the air. You sweat, even if you don't feel it. Your skin loses water continuously through a process called transepidermal water loss. Your kidneys keep working through the night, producing urine and clearing waste products from your blood. By the time you wake up after 7 or 8 hours of sleep, the average adult has lost between 1 and 2 pounds of water weight overnight, purely through breathing, sweating, and normal kidney function. That alone makes you moderately dehydrated every single morning. Your blood is literally thicker when you wake up than when you went to sleep. Now here's where it gets dangerous for seniors. Why dehydration is uniquely dangerous after 60. Aging changes your relationship with water in ways that most people, and honestly, many doctors, don't fully appreciate. First, your sense of thirst becomes unreliable. This is well documented in the medical literature. As you age, the thirst mechanism that normally alerts you to drink water becomes blunted. A 70-year-old can be significantly dehydrated and feel no thirst whatsoever. Their body simply stops sending the signal clearly. This means seniors cannot trust their body to tell them when they need water. By the time an older adult feels thirsty, they're often already in a state of clinical dehydration. Second, your kidneys become less efficient at conserving water. In younger adults, when fluid intake drops, the kidneys rapidly increase their water reabsorption to compensate. In older adults, this compensatory mechanism is slower and weaker. Seniors lose water more easily and replace it more slowly. Third, and this is the one that directly connects to stroke, dehydration in seniors causes a measurable increase in blood viscosity. Blood viscosity means how thick and sticky your blood is. When you're dehydrated, you have less water in your bloodstream, but the same number of red blood cells, platelets, clotting proteins, and cellular debris. Everything gets more concentrated. Your blood becomes more like syrup and less like water. And thick, syrupy blood moving through already narrowed, already stiffened cerebral arteries is a formula for disaster. The direct stroke mechanism. Let me walk you through exactly what happens step by step on a morning when a senior wakes up and doesn't drink water for the first hour or two. Step 1. You wake up already mildly dehydrated from overnight fluid losses. Your blood is approximately 1 to 3% more viscous than it was at bedtime. For a young person, this is trivial. For a 70-year-old with already narrowed arteries, this matters. Step 2. You get up and immediately begin your morning routine, going to the bathroom, perhaps making coffee or tea, turning on the news. You don't drink water. Maybe you don't feel thirsty. Maybe you're not in the habit. Maybe you're waiting for breakfast. Step 3. Within the first 30 to 60 minutes of being awake, your blood pressure naturally surges. This is called the morning blood pressure surge, and it's a normal circadian phenomenon. Your body releases cortisol and adrenaline to prepare you for activity. Blood pressure spikes by 10 to 25 millimeters mercury in most adults. In seniors with hypertension, and over 70% of Americans over 65 have hypertension, this surge can be dramatic. Step 4. Thickened blood plus a pressure surge now hits those narrowed, stiffened cerebral arteries. The pressure spike strains the already fragile endothelial lining. If there are vulnerable plaques, fatty deposits on arterial walls, the pressure can crack them open. When a plaque ruptures, the body's clotting system responds instantly, sending platelets to seal the rupture. But in thick, dehydrated blood, those platelets are already more prone to clumping. A clot forms. If that clot breaks free and travels upstream into the brain, you have an ischemic stroke. Step 5. Even without a rupture, the combination of thick blood moving slowly through narrow vessels can cause blood flow to the brain to drop below the threshold needed for normal function. A transient ischemic attack, or TIA, sometimes called a mini stroke. Most seniors who have TIAs don't even realize it. They feel briefly dizzy, confused, or notice a few seconds of numbness. Then it passes, and they write it off as tiredness or age. A landmark study published in the journal Stroke found that the morning hours between 6 a.m. and noon carry a 49% higher risk of ischemic stroke compared to other times of day. The peak of that window? Right at waking. Right when blood is thickest and blood pressure is spiking. Right before most people have had a single drop of water. The research is clearer than you've been told. Let me share the specific evidence that convinced me to make morning hydration an explicit, urgent conversation with every senior patient I see. A study published in the American Journal of Epidemiology followed over 20,000 adults and found that people who drank 5 or more glasses of water daily had a 54% lower risk of fatal coronary heart disease compared to those who drank 2 or fewer glasses. The mechanism was directly related to blood viscosity and platelet aggregation, the same clotting dynamics that drive ischemic stroke. Research from Loma Linda University found that adequate daily water intake was associated with a significantly lower risk of stroke in women over 60. The effect was independent of other lifestyle factors. A study in the journal Clinical Hemorrheology and Microcirculation found that even mild dehydration, as little as 1 to 2% of body weight loss through fluid deficit, increased blood viscosity enough to meaningfully elevate clotting risk in older adults. That 1 to 2% loss? That's exactly what happens overnight while you sleep. A European research team studying morning blood pressure patterns found that seniors who drank 500 milliliters of water, roughly 16 ounces, within 30 minutes of waking, showed a measurable reduction in morning blood pressure surge. The water essentially diluted the blood and reduced the cardiovascular strain of the morning cortisol spike. And perhaps most compelling, a study from the National Institute of Neurological Disorders and Stroke found that dehydration at the time of hospital admission was associated with significantly worse stroke outcomes. Patients who arrived dehydrated had larger infarct volumes, meaning more brain tissue was destroyed, and worse functional recovery at 90 days. This isn't fringe science. This isn't wellness culture. This is published, peer-reviewed, replicated research telling us that the single most unprotected window in a senior's day is the hour after waking, and the single cheapest and most powerful intervention is water. The second part of the habit: coffee first. Now I want to address something that millions of seniors do every single morning immediately after getting up, and that's reaching for coffee before anything else. I'm not here to take away your morning coffee. I drink it myself. But there is a critical sequence problem that dramatically compounds morning dehydration risk. Caffeine is a mild diuretic. When you drink coffee, your kidneys respond by excreting more water than the coffee itself contained. On a normal, well-hydrated morning, this is trivially irrelevant. But on a morning when you're already waking up in a mild dehydration deficit, which, as we've established, is every morning for most seniors, drinking coffee before water adds a second layer of fluid depletion on top of an already compromised baseline. You're waking up dehydrated, then you're having a diuretic, then you're waiting another hour or two for breakfast before drinking any significant amount of water. Meanwhile, your blood pressure is surging, your blood is thickening, and your brain is running on narrowing margins. A study in the journal Hypertension found that caffeine consumption in the morning produced an additional elevation in blood pressure on top of the already existing morning surge, and this effect was more pronounced in older adults and in habitual hypertensive patients. The combination of morning pressure surge plus caffeine-induced pressure elevation plus dehydration-thickened blood is not something I can overstate the risk of. The fix is not to stop drinking coffee. The fix is embarrassingly simple. Drink water first. The third overlooked trigger: hot showers. There's one more component of the morning routine that too few people connect to stroke risk, and that is the hot shower. When you step into a hot shower, your peripheral blood vessels dilate rapidly in response to the heat. blood rushes toward the skin surface to help dissipate heat. This causes a temporary drop in blood pressure as volume is redistributed away from the core. In young, healthy adults, this is compensated for instantly by the cardiovascular system. In seniors, especially those on blood pressure medications, which themselves can cause orthostatic hypotension, this temporary drop in blood pressure can reduce cerebral perfusion pressure enough to trigger a TIA, or, in severe cases, an ischemic event. The risk is highest when the hot shower is taken before adequate hydration and before breakfast. Low fluid volume plus blood pressure medication plus heat-induced vasodilation plus the lingering effects of overnight dehydration can combine into a genuinely dangerous morning for a senior's brain. This doesn't mean cold showers only. It means drink your water first, have something to eat, give your body a fighting chance before you step into a hot environment that's going to redistribute your already depleted blood volume. What to do starting tomorrow morning? Here is the practical protocol. These are not dramatic changes. They require no prescription, no gym membership, no special equipment. They require only awareness and a shift in sequence. Step 1. Water before anything else. Keep a full glass or bottle of water on your nightstand before you go to sleep. The moment you wake up, before coffee, before your phone, before the bathroom if you can manage it, drink it. A minimum of 16 ounces, ideally 20. Room temperature or slightly warm is fine. Cold water is fine too. The temperature matters far less than the act of drinking it. This single step begins reversing your overnight blood thickening before your blood pressure surge peaks. It's the most impactful thing a senior can do to reduce their morning stroke window, and it costs nothing. Step 2. Wait 20 minutes before coffee. Give your body time to absorb and distribute that water before you introduce a diuretic. 20 minutes is enough. You don't have to wait an hour. Just break the habit of coffee being the absolute first thing. Step 3. Don't rush out of bed. The transition from lying flat to standing upright causes an immediate redistribution of blood volume. In seniors, this can drop blood pressure suddenly, called orthostatic hypotension, and reduce blood flow to the brain. Sit on the edge of your bed for 60 seconds before standing. Drink your water while you're still sitting. Let your cardiovascular system adjust. Step 4. Track your water intake throughout the day. Most seniors are chronically underhydrated, not just in the mornings. The old rule of 8 glasses a day is actually a reasonable starting point for older adults. But your goal should be that your urine stays pale yellow throughout the day. Dark yellow urine is your body's warning signal that you're dehydrated. Step 5. Know your blood pressure numbers. If you're over 60 and you don't know your morning blood pressure, you are flying blind. Get a home blood pressure monitor. They cost under $30. Take your reading in the morning, 30 minutes after waking, and after drinking your water, before coffee, before medication. Write it down. A consistent morning reading above 130/80 is a conversation you need to have with your doctor urgently. Step 6. Know the warning signs of stroke. Every senior and every person who loves a senior should have these memorized. The acronym is FAST. Face drooping on one side. Arm weakness. Can they raise both arms evenly? Speech difficulty. Is it slurred or strange? Time to call 911. Every minute of untreated stroke destroys approximately 1.9 million neurons. Speed is everything. The medications that quietly make this worse. I want to take a moment to address something that most doctors don't communicate clearly enough to their older patients. Certain extremely common medications dramatically increase dehydration risk and stroke vulnerability, and they interact directly with the morning habits we've been discussing. Diuretics, water pills, are prescribed to millions of seniors for heart failure, hypertension, and edema. They work by making your kidneys excrete more fluid. But if you're taking a diuretic, waking up already mildly dehydrated, skipping morning water, and drinking coffee first, you are compounding 3 dehydrating factors simultaneously before your day has even started. ACE inhibitors and ARBs, 2 of the most commonly prescribed blood pressure medications, can cause significant orthostatic hypotension, that sudden drop in blood pressure when you stand up. When you're dehydrated, this effect is dramatically amplified. Standing up quickly from bed on an empty, dehydrated morning while on these medications is exactly the scenario that lands seniors in emergency rooms. Beta blockers blunt the heart's ability to compensate for sudden changes in blood pressure and posture. They slow the heart rate. They reduce cardiac output. On a well-hydrated morning, this is manageable. On a dehydrated morning, with a morning pressure surge, the mismatch between the brain's demand for blood and the heart's blunted ability to supply it becomes a genuine vulnerability. I'm not telling you to stop your medications. I am telling you that if you are on any of these medications, the morning hydration protocol I just described is not optional. It is urgent. Please talk to your doctor about your morning fluid intake and tell them specifically that you've learned about the intersection of these medications with morning blood viscosity and orthostatic hypotension. What a stroke actually looks like before it happens. One more thing I need to tell you, because it may be the most important part of this entire conversation. Mini strokes are preceded by warning signs that are dismissed or explained away, often for days or even weeks before the major event. These warnings are called TIAs, transient ischemic attacks. They are your brain sending up a flare, telling you that blood flow was briefly interrupted. The problem is that TIA symptoms are often mild, brief, and easy to rationalize. A few seconds of confusion, a moment where one hand felt strangely numb, a sudden headache that passed quickly, feeling briefly off balance or dizzy getting out of bed in the morning. If any of these things have happened to you, especially in the morning, especially after sleeping, please tell your doctor. Don't write it off as age. Don't assume it was nothing. A TIA is a medical emergency even when it resolves completely, because up to 15% of people who have a TIA will have a major stroke within the next 3 months, with the highest risk in the first 48 hours. The morning window, the dehydration, the blood pressure surge, these are the conditions that make TIAs most likely to escalate. And getting a TIA properly evaluated and treated can genuinely save your life or prevent devastating permanent disability. If this video gave you information you hadn't heard before, please share it with someone over 60 in your life, a parent, a spouse, a neighbor, a friend. The people most at risk are often the least likely to be searching for this information themselves. Hit subscribe so you don't miss the follow-up videos on morning blood pressure management and the specific foods that support cerebrovascular health after 60. The next video could be the one that changes everything.